Hi, it's Miss Sally. I want to share something with you guys. I want to talk to you about SIBO. I had SIBO. And those of you, if you're watching this video, you know all about SIBO, and I'm not going to bore you with what SIBO is, but let me just tell you, we all know it's flipping horrible, right? So, I had an episode of food poisoning. After I had that episode of food poisoning, I was never right. I couldn't digest grains. I looked like I was, 3 months pregnant. Then after I finally got to where I was about 6 months pregnant, and I'd even gotten so bad off that I was bloated even in the morning. You know how like most of the time with SIBO, it's kind of like not till after you eat, and then you're like, oh, right, you wake up with a flat stomach. Well, I was to the point, it was so bad, I wasn't even waking up with a flat stomach anymore. Like, it was terrible. And I would show you some pictures, but being a woman, I had taken some pictures of how bloated I would get, for just in case I ever found a treatment, that I could show hey, now I don't have all that. But what would happen is I would never get better, so then I would delete those pictures. And I wouldn't get better because I was all the time trying to treat SIBO. But SIBO is a parasitic infection. SIBO, let me say it again, is caused by parasites. Your small intestine is not moving fast enough because of parasitic infections. Parasites slow down your motility of your small intestines, and then you get a secondary bacterial infection. SIBO is a symptom. SIBO is not the cause. SIBO is a symptom of parasitic infections. It's a symptom. So what you got to do, and this is really hard, it's very difficult to get a positive parasite finding on stool test. Well, Miss Sally, why is that? Well, I'm going to tell you why. And it's disgusting, okay? It is because in our country, we don't test for parasites properly at all. One of the things that we do wrong is that the preservative that they put on the stool actually sometimes destroys the parasites. That's what one doctor told me, and I believe him. But so then there's that problem. So that even if the parasites are in the stool, then by the time it gets to the lab, it's destroyed because of the preservative, which is terrible. But then the other problem is too, happy parasites are just plain and simply not playing in your stool. They're not. They are tucked away in your organs. They are even inside of your tissues. They are not playing in your stool. So the best thing you can do is make them unhappy before you do a stool test. So if I had it to do over, what I would do is I would buy a parasitic detox. You can get one from online by Renew Life. You can use Cellcore. I don't care what you take. But you take it for about a week, stir them up, get them pissed off. Then they might actually be in your stool. Or at least maybe then some of the eggs have gotten into your stool. And see, then do your stool test. And I would also, I wonder if you can call some of these labs that do them and ask them if they would humor you and send you the cup that has the solution in it, the preservative, they call it a brine, but also send you a cup that has nothing. Because I think that would be the best way to find them. But anyway, let's get back on track. All right, so what I did was I got lucky. My doctor, I had talked her into prescribing me a prescription strength anti-parasitic. So she prescribed me albendazole. And I had ordered, I said, look, I'm so desperate. I'm so miserable. Please let me try it. I will do another parasite test. So I had been doing them twice a year, stool studies anyway, twice a year, okay, for 10 years. $300-400 a pop. Think about how many thousands of dollars I spent. So, but she, at this point, after 10 years of dealing with me, she's like, yes, I will do that for you. And I really was going to do the stool test first, but it got lost in the mail. So I took the albendazole first. I had been on albendazole for about 4 days. Now remember, nobody had ever found any parasites. They'd find bacteria, we treat that bacteria, then guess what? Next time it's a different bacteria, we treat that one. You do another test, now it's another bacteria. H. pylori, H. pylori, H. pylori. Could never get rid of H. pylori until I got rid of the parasites. That's right. If you can't get rid of H. pylori, you probably have a parasitic infection. Parasites harbor bacteria. They harbor H. pylori. So even if you take your H. pylori treatment, you're being re-inoculated by the parasites that are in you. Anyway, it got lost in the mail. So then by the time I got it, I had been on albendazole for 4 days. I sent the stool test. They found two parasites. They found 2. Hadn't found any before. Isn't that amazing? So then after I treated the parasites, and I took the medication for longer than what the CDC says, whatever, yeah. I don't think we treat parasites right in our country, but I'm just going to tell you, I took a longer course than normal, and I did do several different rounds. But can I just tell you that after the first round, I could digest garlic, onions, and I could stand to take probiotics. Because before, garlic, onions, and probiotics made me, I thought really I would get so bloated that literally I thought my stomach would burst. And I know that you know, if you have SIBO, you know exactly what I'm talking about. And if you have SIBO, stay away from probiotics because you already have an overgrowth of bacteria and you are adding fuel to the fire. You're never going to rebalance any kind of microbiome as long as your small intestines are not moving at the rate they're supposed to move. You have to get rid of the parasites. At least kill them down. I don't know if we ever truly eradicate parasites, but you got to get a handle on those first, okay? So I recommend that you do that. And if you keep getting negative test results, and I hate that because I know that's going to happen to some of you because it's very difficult to get a positive. In a lot of other countries, you know what they do? They literally have these in-home testing kits where you can poke your finger, a drop of blood, they test for a variety of antigens to see which parasites you have. Yeah, in your home even. And in America, they make those tests. They're not allowed to distribute them in the States. They have to ship them overseas because those tests are available and recognized, and that's how they test for parasites a lot of times in other countries, especially like England and stuff, is they look at the blood. They don't mess around with the stool. I'm not going to say they never, I don't know that they don't ever look at the stool, but that is a substandard way. That is not how we should be doing anything in the flipping first world country. But my advice to you is keep probing your doctor, probing your doctor, probing your doctor. And maybe you can talk them into letting you try some anti-parasitic medications just based on your symptoms. I mean, you might be able to talk a naturopath into that. You probably can't talk a regular doctor into that because they're taught that we don't have parasites in America because it's a first world country and something about hygiene. I don't know. Parasites live in the dirt, so does the food. So it's not logical to me that we would not have parasites. Of course we have parasites. And in some countries, they even prophylactically, treat their citizens for parasites annually. So we are so behind the 8 ball in the States. Like we're pretty much overrun with parasites on the inside. I'm not trying to freak you out or scare you because you can get a handle on them. You can. But that's going to help you with your SIBO journey. You know what I mean? Anyway, talk to you next time. Bye-bye.